Hello, my name is Luigi Biel, student of Dr. Rebecca Doyle's class for Community Assessment, and today I'm here to discuss my Community Health Needs Assessment conducted at a federally qualified health center named Community Health and Wellness Center of Greater Torrington, which is located in Torrington, Connecticut. As mentioned earlier in the title, the Community Health and Wellness Center of Greater Torrington is an FQHC that receives funds from the Health Resources and Services Administration, also known as HRSA, to provide healthcare services ranging from primary care, women's health, dental care, infectious disease medicine, and behavioral health services. This center services over 10,000 community members per year and was recently awarded the 2017 National Quality Leader Award from the HRSA Health Center program. The target population for this community health assessment applies to all residents living in the general vicinity of the Torrington area. The overall focus of the community health assessment is to determine what needs there are in the community for additional health programs, or if there's a need for reallocation of resources to existing programs in the community. The chosen logic model, which will be used to act as a planning framework for the community health assessment, will be the Proceed-Proceed model. The Proceed-Proceed model allows an organization to utilize an ecological approach when attempting to elicit a change in the health behavior while being aware of changes in an individual's environment to assist in desired health behavior changes. The Proceed-Proceed model consists of two overall phases made up of several steps. First, the Proceed phase, which describes the process that leads up to an intervention and focuses on identifying program goals needed prior to implementation of the health intervention. And it also highlights other key items including prioritization of community health issues, identification of possible community hindrances during the health intervention, and creation of health policies to ensure long-standing success. The Proceed phase offers steps in program analysis during implementation of the health intervention to ensure long-standing program performance and attendance by community members. First settled in 1735, Torrington, Connecticut became a town in 1740 and later incorporated itself into a city by 1923. Current population estimates have fallen to 35,000 citizens since the last U.S. Census, which was a change of 4.8%. 50.4% of the population consists of the male gender, with 49.6% consisting of the female gender. The ethnic composition of the population in Torrington is predominantly white, with Hispanic populations coming in second, non-Hispanic African Americans in third, and lastly, Asians in fourth. The median age range of the city is 44.5 years, though it is an up-and-coming city amongst the youth, with the second largest group being 18 to 24-year-olds. 3 determinants of health were identified in the community through the community health assessment. First, Torrington was found to have transportation issues which limited access to health care. Many patients receiving healthcare services within the community did not have access to personal vehicles, and the community does not offer any public transportation services. Some specialty provider clinics are 45 minutes away from Torrington, so there is a challenge in getting timely healthcare services. Secondly, the poverty level in Torrington is very high, meaning that patients do not have enough money to be able to pay for needed medical services as they have other needs to meet first. Furthermore, the local economy is lacking, meaning that there is little to no work available in the area, causing an overabundance of low socioeconomic status members in the community. Most importantly, the community has a lack of healthcare providers in the area, meaning that the providers that are currently there are overworked and have little access to needed services that the patient population requires. Due to a high prevalence rate of opioid abuse, the healthcare providers face increased risks when seeing patients in the area. The County Health Rankings and Roadmaps program released their annual report for Litchfield County, where Torrington, Connecticut is located, indicating that they were in 4th place. This report ranks counties based on measures related to vital health outcomes and health factors associated with every community, such as access to clinical care, socioeconomic factors influencing health, quality of life, and other factors. Geographical limitations were found to be a major issue. Torrington, Connecticut is located within the northwest section of the state, where there isn't any available public transportation. Residents who face challenges in finding access with transportation due to external factors miss vital preventive health measures for basic health services. Furthermore, Many of the problems listed above are magnified due to Torrington being in a health professional shortage area, known as HIPSA. Having less medical health care providers in Litchfield County places community members at a disadvantage as regular day-to-day difficulties hinder any desire to get the proper care. The table below shows the population to provider ratio for primary care and mental health professionals in Litchfield County when compared to Connecticut. Of all health disparities examined throughout the community health assessment in Torrington, the opioid epidemic was extremely concerning for the county. Deaths from opioid overdoses have exceeded state and national metrics yearly since 2013, indicating a need for immediate intervention as Connecticut has surpassed the U.S. national average. On average, 3 people die of opioid use every day, with more people dying from drug overdoses when compared to other non-medical deaths, including homicides, suicides, and motor vehicle crashes combined. Amy Begnell, Quality Manager at Community Health and Wellness Center for the past 7 years along with community stakeholder, went on to explain during an interview of the contributing factors linked to opioid addiction, including patients with a history of mental illness, acute and chronic pain, or poor familial relationships which encourage prolonged opioid use. Furthermore, she also added that Torrington is disproportionately affected within its rural community as it is lacking needed community outreach and treatment services, while also having a large amount of halfway and sober living homes, which draw in plenty of community members with past or current addictions from different parts of the state. Key findings obtained through the community health assessment include increasing the local economy in Torrington to increase morale amongst community members. This would also contribute to an overall county health ranking increase, as there have been studies that correlate income level to overall health benefits. Increasing the number of healthcare providers in Torrington would also place community members at an advantage, as current day-to-day difficulties may hinder any desire to get the proper care due to lack of transportation services. Raising the population to provider ratio for primary care and mental health services in the county. This would increase provider to patient time spent during an encounter, which would also allow more interaction with a patient to provider. Raising the health literacy associated to reproductive health in the community through health programs and preventive care would decrease morbidity rates of STIs in the area. Increasing the behavioral health case management services to continue ongoing treatment for addiction services such as opiate abuse, alcohol, substance abuse, and so forth, to decrease the current rates of addiction in the city. Thank you for listening. Again, my name is Luigi Biel. Have a nice day.